One bite at a Thank you, Lachey. So this meeting will be recorded without anyone's names or videos. It is so nice to see so many of you joining that I'm familiar with, your names, and those of you that have your videos on. Thank you for coming. And welcome. This is One Bite at a Time, Emerging Insights in Survivorship Nutrition. And our topic today is nutritional psychiatry. These topics that we choose here are usually very big subjects that we break down and try to put in digestible small bites. And today, let me go ahead and introduce myself. Welcome. I'm Megan Laszlo. I'm an outpatient oncology dietitian and clinical nutrition coordinator for our patient and family support program here at Cedars Sinai Cancer. And I'm joined here by Dr. Natalie Mullen, who is one of our psychiatrists and is also a diplomat of the American Board of Psychiatry and Neurology. Thank you so much for being here.
Thanks for inviting me.
It's a pleasure to have you. I am sharing my screen, so you can play with your controls and get it set up so that you can see both our images and the content in the presentation. I will ask everyone to stay muted the entire time, please. And then at the end, we can moderate the Q&A. So if you have any questions as we go along, please go ahead and type your question into the chat and we'll get to those at the very end. So let's go ahead and get started. So I want to just talk about nutritional psychiatry and what it is. For those of you that haven't heard of nutritional psychiatry before, it's an area of study that explores how foods, nutrients, and the gut microbiome affect brain health and emotional well-being. And there's different areas of focus. The interest in nutritional psychiatry is that it may help support individuals with anxiety, depression, bipolar disorder, eating disorders, and others. And a part of that interest is that mental illness has been viewed as this brain-related disease caused by changes in neurotransmitter signaling, but alterations in energy metabolism appear to play a role as well. Within this topic, we really want to focus on depression because we know that it disproportionately affects the oncology population. It affects about 25% of cancer patients. We have our symptoms listed up there, which you're likely familiar with. And we know that depression worsens quality of life, treatment adherence, hospitalizations, and mortality. And that treatment of depression improves survival. We have some of our potential causes up here, and you can see how these are general, but you can see how they all relate to cancer or its treatment. And some of the mechanisms of action that relate specifically to nutritional psychiatry are inflammation. It can be a driver of depression and cancer. We know that cancer and its treatments can increase levels of pro-inflammatory cytokines listed there, and that inflammation can disrupt neurotransmitters and affect the reward motivation circuits. Inflammation can also be caused by infections, microbiome disruption, obesity, smoking. And we also know there's a relationship between the gut-brain axis, where gut microbiome dysfunction can lead to altered vitamin metabolism, which in turn can lead to mitochondrial dysfunction and mood alteration. And so that's kind of the flow that we're going to be taking a look at today. For depression treatment, we know that there's many different antidepressant medications that are used, including psychotherapy as first-line treatment. And there appears to also be a benefit of potentially dietary changes, as well as exercise and other forms of support as well. But I wanted to ask you, Dr. Mullen, do you find that individuals are hesitant to use medication for depression out of concern for side effects such as weight gain?
Yes, definitely. Weight gain is one of the major deterrents, but honestly, the majority of our antidepressants that we are using nowadays have less risk of weight gain than the ones from the past. And often if somebody has weight gain with one medication, we can switch them to another one and they may not have as much. So there's flexibility.
Okay, good. That's good to know because I can see how that would be a big deterrent to wanting to trial medications.
So sometimes with cancer treatment, you really want to gain weight. And so we really want to use those that ability of medication to improve somebody's ability to stay nourished.
Excellent. I'm definitely seeing certain antidepressants used for that purpose as well.
Absolutely.
That's good to know. Thank you. I wanted to highlight some of the relationship of specific nutrients to depression, but just in general, thinking that when a lot of these nutrient intakes go down or they're in deficiency, that depression risk increases. Move this over here. As well. So I wanted to highlight some of these micronutrients and the role that they play. Vitamin D being one of them. We know that vitamin D plays a role in the production of neurotransmitters and may have antioxidant effects on brain tissue. Low levels are associated with depression, and it appears that supplementation is associated with reduced depressive scores. Vitamin D deficiency may worsen symptoms of depression, anxiety, and seasonal affective disorder, which is one of the reasons I wanted to talk about this today. We're in January. And I wanted to highlight some of our food sources. We know that vitamin D is a sunshine vitamin, and we do get our levels increased through sun exposure, but we can also find it in fatty fish and foods that are fortified with vitamin D, like milk and dairy products. Omega-3 fatty acids play a key role in brain development and health and may lower inflammation in brain tissue. We know that eating fish is associated with lower risk of depression, and eating fish a couple times per week is a recommendation from the American Psychiatric Association. Fish oil supplementation, especially with EPA, does appear to be useful for preventing and improving depressive symptoms as well. And then we have our food sources listed there, fatty fish like salmon, tuna, sardines, mackerel, trout, as well as nuts and seeds. Although I will say the fatty fish are much better sources of EPA specifically compared to the nuts and seeds. Folate. So folate plays a role in the production of neurotransmitters involved in depression. Low levels may prevent the effectiveness of depression treatment through medication. And we know that deficiency may worsen cognitive impairment and depression. Folate is present throughout the diet, but mostly in dark leafy greens. When we talk about folic acid is the supplement form of folate. Folate is what we find in food. And then vitamin D. Vitamin D plays a key role in brain development and production of neurotransmitters. Deficiency may worsen symptoms of depression and anxiety. And we have our animal-based food sources there that provide us with vitamin B12. And magnesium. Magnesium is needed for enzymatic, hormonal, and neurotransmitter processes. Deficiency of magnesium can worsen depression, and you can see our food sources there. And similar with zinc. Zinc we also need for enzymatic, hormonal, and neurotransmitter processes. Zinc deficiency can also worsen depression, anxiety, and also sleep quality. And then we have our food sources listed there. And so I want to just highlight our food sources for a moment. And so when we think about nutrition for depression, think about eating these foods. And these are foods that we recommend as part of a healthy diet in general, but I think that there could be some renewed focus on these foods in particular and making sure that you're getting adequate amounts. Polyphenols. Polyphenols are found throughout the diet. There's over 8,000 different types, and they seem to have a protective effect on the brain. There's also a correlation between antioxidant intake and the risk of depression. We want to have a diet that's rich in antioxidants. And so when we think about that, we really want these plant-based foods. We want to have tea, we want to have coffee, we want to have spices and herbs and chocolate. And so thinking about these foods that are rich in polyphenols, because they do appear to increase neurotransmitters, balance the gut microbiota, the balance of good bacteria and bad bacteria in our gut, and may reduce symptoms of depression. Lastly, psychobiotics. You've probably heard of prebiotics and probiotics and postbiotics, symbiotics, and now we have psychobiotics. Psychobiotics are basically probiotics. They're bacteria that have mental health benefits, and they appear to regulate these neuroactive metabolites. I found this study to be very interesting. This is from BMC Cancer, published last year. It was a population-based study of about 3,000 cancer survivors, and they found that high intake of probiotics from foods and supplements is associated with lower mortality in individuals with a history of cancer. And I looked at like what they considered to be high intake, and it was actually not that much. The high category was about the equivalent of 0.01 billion colony forming units per gram, and a serving of yogurt has about 6 billion. So really, you don't need probiotic supplements to be in the high category of this study, and there does appear to be a benefit there. We know that eating fermented foods like yogurt, kefir, kimchi, sauerkraut, are beneficial to our gut microbiome. And that's something that we encourage along with high fiber diet intake to help support the gut microbiome. And then lastly, in this study, those that consumed more probiotics had lower depression scores as well. So I thought that was an interesting thing to include. So question, Dr. Mullen, do you recommend micronutrient supplementation during depression treatment, giving all this evidence about specific micronutrients and their relationship to depression?
Not really. I think just like you were saying, we prefer people get their micronutrients through food. If there's a specific deficiency that we've identified, like we will check for low vitamin D, low folate, low B12. If we can find something that's very specific, then we will recommend that you take a certain dose of vitamin D or B12, folate, and then we'll check to make sure that you actually were able to absorb it. And if you get your levels back to within the normal range, then you don't need to supplement anymore. We can check you a little bit later, but I really want to encourage people to eat this broad spectrum of food and get the nutrients, in community with all the benefits of eating with other people, and just be eating normally. Don't medicalize necessarily your vitamin intake. Don't medicalize your food.
Okay. So it sounds like a food first
Definitely.
approach.
Absolutely.
And then and really replete micronutrient supplements if the deficiency is identified. Not a blanket recommendation to take any dietary supplements. Okay. Yeah, good. And so with that, I think it makes sense to talk about dietary patterns, the way we eat over time, not over focus on one particular food or one particular nutrient. I wanted to highlight this study. It was a population-based study that examined the effects of depressive symptoms and dietary patterns in a cohort of cancer survivors over a period of time. And so they looked at how these different dietary patterns like DASH, which is dietary advances to stop hypertension, that eating plan is outlined here if you're unfamiliar with it, and the Mediterranean diet. And they found that adherence to these two different plant-based diets were identified as strategies to lower mortality, so lower risk of death. And the association between those with lower depression scores and higher adherence to DASH, well, they found association. So if you had low depression scores, you were probably eating a DASH diet or a Mediterranean diet in this analysis. So it seemed to be a benefit and a relationship there. Another study, this one came out a few years ago in Nutrients. They showed that the Mediterranean diet was beneficial for the prevention of depression, and that it may also improve symptoms of depression. And we know that a Mediterranean diet improves cardiovascular disease and metabolic conditions. It's used as this kind of like model diet plan. I think some variations can be appropriate, but we'll talk more about that in a moment. And I wanted to highlight this as well, because we found another study showing that those that incorporated like polyphenols and fiber through a MIND diet plan and that they had significant lower chance of depression and psychological distress. And so what is the MIND diet? Another acronym. It's basically a combination of the DASH diet plus the Mediterranean diet. Is often being studied for its benefits for cognition and for maybe preventing dementia, and it's really focused there. But I wanted to highlight what's on it because it seems kind of elusive. So it's really about 3 servings of whole grains each day. A serving is about half a cup, at least 1 dark green salad or 1 other vegetable every day, berries at least twice a week, presumably for their vitamin C content, at least 1 ounce serving of nuts each day, probably for the magnesium, beans or legumes at least every other day, poultry at least twice a week, fish at least once a week. So for our B12 and our omega-3s. They did recommend a 5-ounce glass of wine each day, which I think is very debatable. I likely unnecessary, and we know that alcohol increases cancer risk. So that's not something we're recommending, just highlighting what's on the Mind diet. And to limit to no more than a tablespoon per day of butter or margarine, and to primarily use olive oil as part of our Mediterranean diet, and to limit cheese, fried food, and fast food to no more than once a week. They're in the same category for this diet plan, cheese and fried food, and that's pastries and sweets less than 5 times per week. It seems like a lot. They're not counting sugar with this diet, but I think this is a dietary pattern, not something that's very detailed. Another trial I wanted to highlight is the SMILES trial. This was a 12-week parallel group, single-blind, randomized control trial. It was an intervention for treatment of moderate to severe depression. And they took 67 individuals and randomized them to either receive dietary support for an hour 7 times, so once a week for 7 times, or to receive social support for the same time period, but they would just chat about baseball or whatever the person was interested in rather than receiving dietary support, educating them on a Mediterranean style diet. So those that received the dietary support with education on Mediterranean diet had significantly greater improvement in depression and anxiety. Those receiving social support had minimally improved scores for depression and anxiety. And then those with receiving dietary support also had improvement in their diet. They had a higher quality diet, increased consumption of grains, fruits, dairy, olive oil, beans, and fish. And those that had social support had no significant change in their diet.
I do want to interject with this study. What was really interesting was that the results from this study were even better than some of the pharmacological studies that I've seen done. So this is significant. Look what you can do with your diet.
That's great. That's great to know.
Yeah,
You have a really big impact through food choices.
absolutely.
And then, acknowledging that these individuals receive support. And so that support may be something that's essential in order to achieve these changes. And so seeking out the support of a dietitian is encouraged as well. So now is the point where I'd like you to ask yourself, do you follow a Mediterranean diet? Are you eating 5 or more servings of vegetables each day, 3 or more servings of fruit daily? Considering your caloric needs, are you eating whole grains daily? Are you eating brown rice and quinoa and farro and other whole grain sources, oats? Are you using olive oil as your primary cooking oil? Are you eating nuts, seeds, and avocado at least 3 times per week? Are you eating fish and seafood at least 3 times per week if you choose to eat those foods? And do you limit red meat to less than once or twice per week? That's something to consider here. And I just want to acknowledge that a serving in this context is a half a cup of fresh fruit as well, or half a cup of vegetable. If it's a dark leafy green, then it's a cup. Dr. Mullen, are there any other specific eating habits that you recommend for depression?
I always encourage people to eat with others. Try not to be as isolated. To try not to fall into all or nothing thinking like, oh, if I didn't do it right today. To try with your next meal. You don't have to incorporate all of this all at once. If this is new to you, just try small changes and notice how you feel. Check in. How do I feel after I try eating this way for a day? Am I tired? How's my energy? And I think don't fall into the trap of, oh, I don't feel good. I'm just going to eat whatever I want, low quality foods, because that tends to reinforce that bad feeling. Treat yourself to some really good fresh food, even if you don't make it, if you pick it up or whatever. It makes a big difference.
And keep driving towards the habit and the diet.
Yeah, and habits are made over time. It's not, it's setting an intention and always aiming for that, going towards that. Perfection is the enemy of getting anything done. So just just try a little every day. Just keep course correcting. What worked today? What didn't work? Okay, I'm going to avoid that. Keep
Yeah.
trying. Go for it.
Changes don't happen overnight.
For sure.
So some of our conclusions with this content, one are that diet and depressive symptoms are connected, and together they do appear to influence mortality in cancer survivors. This is important. We know that adequate nutrient intake can optimize medication effectiveness. So that's something to also pay attention to as well, which can be more nuanced and detailed. And that's something to speak with your provider about. And that dietary changes are really a non-invasive and also cost-effective adjunct to therapy. We don't want to just treat with one way. We want to consider the whole person and all of their needs. As we were talking about earlier, it's not just medication, it's diet, it's exercise, it's social support, it's multifaceted. And then, the same foods that support physical health also support mental health. And I'm sure that some of this is repetitive. You're saying, oh, okay, well, eat healthy fats and eat beans and eat nuts and seeds and dark leafy greens. And yes, that is what we want individuals to choose. So I wanted to highlight a recipe as we do here. For anyone joining in person, we have nutritional yeast popcorn. This is a recipe courtesy of my colleague, Diana Torres, is a dietitian with us. And it's very simple to make. It's homemade popcorn on the stove. And we basically added a little bit of olive oil, some nutritional yeast, and salt. And popcorn is a whole grain. It's high fiber, it's a whole grain, it's crunchy, it's satisfying. And the reason we're using nutritional yeast rather than Parmesan is because it is extremely dense in B vitamins. You can see here we're highlighting Frontier Co-op nutritional yeast. This is a product recommended by Consumer Lab Reports. For quality. Here I use the Trader Joe's brand. I think it had like one nutrient that wasn't as high as it was supposed to be on the label and then Consumer Lab Reports, but it's still a good product. But I wanted to highlight these nutrition facts for a moment. So a serving size here is 2 tablespoons. And then if you look at this percent daily value, you can see if it has 20% or more, it's considered high. And so with this particular product, thiamine is very high, riboflavin is extremely high, niacin, B6, folic acid is 40% of our daily value, vitamin B12, which we mentioned earlier, that supports brain health, is 190% of the daily value, zinc as well. So this is a B vitamin supplement right here. This is a lot.
You don't need to buy a pill for that.
Right, and this is something you can add to popcorn. You could add it to rice. You could put it in mashed potatoes. You could put it in a variety of different things. I like to use it in pesto. Sometimes if I run out of Parmesan and then I realize it would have been the better ingredient to use in the first place. But yeah, great thing to think about and to consider using for its B vitamin purposes. Just a minute. And then I wanted to also highlight that this is being recorded, and all of our One Bite at a Time and all of our wellness, resilience, and survivorship lecture series are on YouTube. These are public lectures, and they're recorded and uploaded there. So if there's anything you want to check out, they're all listed there on our YouTube channel. And then lastly, Cedars Sinai is a nonprofit academic organization serving the diverse Los Angeles community and beyond. These vital programs are powered by the generosity of our compassionate donors, and we invite you to join us in transforming the treatment and survivorship journey for cancer patients. And so we have all of our programs outlined there. These are all donor funded and free to our patients. So if you'd like to support us, you can use that link there and contribute to our programs. So with that, I will stop sharing my screen and we can move on to the Q&A. So we do have some questions in the chat. Thank you so much. We do have someone here in person, so I'll let her ask first. Do you have a question?
I wanted to know if we have to limit our intake of nutritional yeast because it has one.
Do we need to limit our intake of nutritional yeast because it's so concentrated? That's a good question. Thank you. So the serving size there was 2 tablespoons, and it was quite concentrated. I wouldn't suggest someone consume likely that much even. I mean, I think it's how you use it, but I wouldn't imagine someone would consume more than that at one sitting. You can try some there. It's quite has a very strong taste. So I think it may inhibit the excessive consumption of it, but I wouldn't be concerned about over consuming it if you're having it in normal amounts and normal serving sizes. Do you have any additional thoughts about that?
I think it would be hard to do. Yeah, just based on the taste, sort of like with salt. Oh, shouldn't say with salt, but maybe with pepper, like it would be really hard to
It has
think
an
that
intense,
much.
it's kind of
Yeah.
like eating like Parmesan. I don't know. It tastes a little Parmesan to me.
It does
Yeah.
taste like cheese a little bit.
Yeah, but I think it's something you could use on a regular basis if you're someone that's vegan and doesn't consume any animal products. It's a valuable source of vitamin B12 without taking a supplement, but it would need to be consumed regularly.
But I mean, the B vitamins are excreted by your body, so it is kind of hard to overdose on those.
Mhm.
So
Yeah.
I wouldn't worry too much about this.
I had a question about iron.
Sorry?
I had a question about iron in all of this.
Okay.
Folate is different than iron, right?
Yes.
And then I noticed that you were talking about everything except iron when you were explaining. So then, yeah,
Okay.
how does that come into?
Maybe we have a
So
question.
the question is about iron, and you know, we talked about a lot of essential micronutrients. Why didn't we talk about iron? And the reason is I really wanted to highlight nutrients that have a relationship to depression. And so those are the nutrients that have a relationship to depression that we wanted to focus on. Yeah. Are you aware of another relationship with iron and depression?
The only element, I guess, if you're anemic, you will probably have less energy. And, you know, many of our cancer patients are anemic. And so that you may not be depressed, but you may have low energy because you're anemic. And also sometimes with low iron you can get low ferritin, and that can disrupt your sleep. So, you know, problems with sleep can then affect your mood as well, but it's a little different. That's a bit more specific. That's certainly something that we would check if you would if a patient tells me they're having difficulty with sleep, that they're restless, I'm definitely going to check their ferritin level, and that might be something we need to address.
All right, thank you. Does anybody have any questions online that you want to enter into the chat? Give it a moment.
Full fat dairy versus low fat dairy.
So I'm guessing the question is, do we recommend full fat dairy or low fat dairy? This is a big topic that has received a lot of debate. And I think, you know, for this, I'll answer and I'll let you give your take as well. You know, with this, we highlighted a lot of dietary patterns that are the Mediterranean diet, the DASH diet, the MIND diet, and all of those three dietary patterns all suggest low fat dairy and to limit saturated fat in the diet. Um, and so that's something that we would want to recommend doing in this context of depression treatment or even depression prevention using diet.
From my perspective, I think it depends on your cardiovascular health. If you have high cholesterol, you know, you probably don't want to have full fat. So, you know, and unless you're trying to gain weight, I probably wouldn't, you know, you don't want to be having sweets, you know, the ice cream, everybody's favorite, you know, with the high sugar and the high fat.
Mm-hmm.
Yeah.
Yeah, so acknowledging the other components that are in our full fat dairy products and how they may play a role in our health and health outcomes as well. But you know, I agree with you. I think if someone doesn't consume any red meat or butter or other sources of fat, but they choose to have full fat yogurt, I mean, I think it has to be balanced. And that can be very individualized as well. But it is a big topic of discussion that's receiving a lot of debate right now. So thank you for that. Let's see. So I'll ask a couple more questions and then we'll close up for the day. Let's see. Question. Anything to put in place of fish or meat if you eat vegan? So, with this in mind, I really want to highlight the sources of plant-based omega-3s. If you are following a vegan diet, I think they become much more valuable to have things like chia seeds and nuts as sources of the plant-based omega-3 ALA that does convert to EPA and DHA, although the conversion is weak, but I think there's value there in getting essential fatty acids as well. Place of fish or meat. And then thinking about so there's a lot of nutrition concerns and potential for nutrition deficiencies with a vegan diet. B12 is another one. So making sure that you're getting a B12 injection or supplement, or using nutritional yeast, or strategizing to get your vitamin B12 needs met. Those are the nutrients that we spoke about in this context, but there are, of course, other micronutrients of concern with a vegan diet that need to be addressed.
The need for dessert.
Let's see. Okay, this will be our last question. It's, how do you recommend overcoming the need for desserts, especially chocolate ones, when feeling depressed? I would argue that there is a benefit to consuming chocolate.
Dark chocolate.
Dark chocolate, it does contain flavonols and polyphenols. We know that it's a potent antioxidant. I would normally suggest cacao powder. I think organic cacao powder can be used in a lot of great plant-based desserts. I think it's very satisfying, it's very bitter, and then you can control how much sugar is in that product. It's also high in fiber too, so I'll plug it for that reason as well. But I think cacao powder can be a good way to still have chocolate without having excessive amounts of sugar or saturated fats.
Yeah, I think also when you start reducing the amount of sugar that you consume, things taste sweeter. So even fruit starts to taste more like a dessert. In some ways, it's sort of, you change the context of what you're eating. If you're always eating sweet things, the things tend to get sweeter and sweeter and sweeter.
Mm-hmm.
Sort of the same like with salt. If you're over salting things and always eating salty foods, you can kind of reset yourself a little bit. But I think to give it a chance, try reducing the desserts and seeing, like, does my mood feel better? You might be really surprised that need for chocolate, the need for dessert. I think we'll always have a need for chocolate, but the need for dessert is probably going to diminish if you give it a chance.
So cutting it out can help you reacclimate to a lower sugar threshold, or lower the need to have it so frequently.
Right. I mean, if you think about it, when you eat dessert, it's probably the first two bites that taste the best, and then the rest, like, do you even remember? So, it's the same thing. Less can really be more.
Thank you for that. And thank you so much for joining us today. I really appreciate you being here and entertaining this topic with us. We haven't gotten to do a lot of this. I'm so appreciative of your time
Pleasure.
and effort. Thank you. And thank you everyone for joining and for your interest in this subject. For those of you I know, I look forward to seeing you again soon. Thank you for attending.